You want photographs of everything. Even if you don't think it's abusive, he's got a scratch on his shin from a fall in the park. He told you, yeah, I tripped and fell. Take a picture of everything just so you have it. Lab-wise, you have to rule out pathologic causes for these injuries. All right? What if they have a bleeding disorder? What if they have osteogenesis imperfecta? That's why they have all these fractures. So that's your standard workup. The fancy hematology test is usually the inpatient thing. You don't have to send off all these factors, but do coags and the CBC. You don't want to cath the UA in the little kids because there's going to be blood in it from the cath, and then what are you going to do with it? Is the blood from blunt abdominal trauma, or is it from you shoving the catheter up there? So bag them. You can wait for them to go to the bathroom. General tox labs, and then if there's anything in the home, you might want to send for that. You know, there's Keppra in the house. Are they drugging the kid with Keppra? But just general labs, and then as you're indicated, you can send whatever else you want. Radiology-wise, get an X-ray of anything that hurts, anything that's swollen, anything that's not moving properly. Skeletal survey-wise, so these are kind of official recommendations for skeletal surveys. Any children under 24 months with any concern whatsoever. Up to 5 years old, after your history and physical, if you have a concern, get it. Any concern in someone who's nonverbal, non-mobile, in a wheelchair, kind of MRCP type of deal. And then anyone under 2 years old that shares a home with another abused child because they're not verbal enough to tell you what's going on. So you should screen them with a skeletal survey. Real skeletal surveys are apparently very hard to do here. The techs can't handle getting 21 x-rays. I mean, they have a printed out list of exactly what to do, and they come, the night tech is like, do I really have to do all this? Don't do it in the ER. Admit them, they will do it during the daytime. So get the x-rays of what you need for their acute injuries, admit them, the skeletal survey will be done by the tech who knows what they're doing. And it's recommended to repeat it in 2 weeks, again, for those acute fractures that you may have missed. Head imaging, any child with suspicion, obviously. Anyone under 6 months with any suspicion whatsoever, really. Anyone under 2 years with other injuries that are considered non-accidental. Any kid with altered mental status. If the CT, they need an MRI to be done eventually, but that can be done later. Skull x-rays are not very useful, and they'll get it with the skeletal survey anyway. Belly imaging, plain, flat, and upright, you can look for acute obstruction, air fluid levels. SOTO still is technically not very reliable. A positive is good, a negative doesn't necessarily mean nothing, but it's getting better. I would still do it. And then CT with IV contrast is indicated for suspicious, any tenderness in the setting of a non-accidental or elevated LFTs. Consults-wise, if you're lucky to have 24-hour social work, they do a lot of the grunt work here. It's very nice that they are the ones that talk to ACS and write up the notes and get all the family history, but you're not all going to be lucky to have a social worker in-house. So you might have to, God forbid, call the 800 number and call the ACS yourself. Radiology, especially because these x-rays need to be done correctly. Opto for retinal hemorrhages. Trauma surgery should be involved as a consulting service in this. And then ortho is indicated, psych is indicated if they're old enough to be able to talk out. These kids do not only have physical injuries. And then if your hospital has a child abuse specialist, that's what they're there for. Things that look like non-accidental trauma but aren't. Any coagulopathy, bleeding disorder, vitamin K deficiencies, HSP, vasculitides, tingivitis, bruising, ecchymotic, erythema. Hemangiomas, Mongolian spots is very commonly mistaken for bruising, but Mongolian spots are not tender. You know, they can be little or they can be huge, like these two corner ones. But they usually fade by a year or two, but they can persist to the teenage years. So history. How long have you had this? My whole life. Does it hurt? No, it's not gross. OI, obviously, should have to be ruled out in kids with fractures. Photodermatitis can give you these large ecchymotic areas on the skin, but again, they're not going to be tender. And then epidermolysis bullosa is a condition where you get these blistering, burn-like injuries from any sort of minor trauma, friction to the skin. Cultural stuff, it's New York City. You have someone from everywhere. Various things that look bad but are just part of practices. Henna cupping, where you heat up a cup, you put it on the skin, and as it dries, it sucks the skin up into the cup. It's supposed to release your humors, get rid of the poisons. So you'll get your ring of ecchymosis with or without a central clearing. Coining, so when you heat up a coin, you rub it on the skin, and you oil the skin up, and you repeatedly rub it, and you create this petechial bruise pattern. Spooning, spooning is Asian. Take the wet skin and you just repeatedly rub your skin with a porcelain spoon. And then moxibustion is burning herbs and yarn on the skin to decrease your toxins. Oh, I didn't put it up. But cupping, you just put a bunch of cups. There's a bunch of fancy Park Slope hipster places that are doing this now just because they think it makes them feel better. There's coining patterns, it's spooning, just repeated rubbing. So I know these are patterns, you have to ask them, what are your practices, how did this happen? This is this moxibustion stuff. So cupping and the suction, depending on how long you keep the cup on, you can have any number of skin patterns. So just be aware, ask the family what their practices are. Real quick to finish up, child neglect is the most common form of any abuse whatsoever. You don't have to hate your child in order to abuse them. About half of all reported abuse and neglect in developed countries is neglect. A third to half of deaths from child maltreatment are from neglect alone, or neglect in conjunction with other things. Various kinds of neglect: physical, failure to provide adequate clothing, shelter, hygiene, protection, inadequate supervision with harm to the child. I left him alone in the house with knives everywhere. Emotional neglect is a bit crunchier, but failure to provide love, affection, psychological care, security, domestic violence in the presence of the child. But failure to provide psychological care when it's needed. You have a kid that's acutely psychotic and the mother refuses to get treated for that. Educational, failure to enroll in school and ensure school attendance, or medical. We'll see this a lot. The asthma kid whose mother refuses to buy albuterol, refuses to go to the doctor. Chronic illnesses, and the parents couldn't care less. It's neglect. Delay in seeking care for injuries or sicknesses should raise your suspicion. Lack of adherence to healthcare recommendations, with the caveat that you have to make simple, clear healthcare instructions. Many of the things we tell parents are not clear and obvious and easy to follow if you don't have the proper education or you don't have the understanding of the disease process itself. Diabetes is very hard for someone to understand. So you can't just give them a list of medications and a correction factor and expect them to know what they're doing. So lack of adherence to recommendations, but you have to make sure that they understand what the recommendations are, why they're doing this, why their child is sick, what these medications do. You can't just, oh, she didn't get the medicine, call PCS. And then really quick, one slide on emotional neglect. Different kinds of emotional injuries that parents, whether rejecting them, isolating them, not allowing them social contact, terrorizing them, verbally assaulting them, ignoring them, just being completely unavailable, pretending they don't exist, reinforcing deviant behavior. Verbal assault, overpressuring, very high standards that the child will never be able to live up to, all falls under the emotional neglect. But again, this is kind of soft definition. It's hard to prove. I don't think I've ever called ACS emotional neglect. But just be aware. You can just watch the interaction of the family with the child and see what's going on. That's all I got. I didn't have time to do resources, but I used them. I didn't make that up. Any questions at all? Yes?
So just logistically, how do you go about calling ACS, informing them, making sure they don't in this process of
So, I mean, the easiest thing to do if you're by yourself is Google the state ACS number. So you call them. They make it a very easy process. What's your name? It's like calling Boys in Control. They ask all the information. They ask, what are your suspicions? They ask for a basic story. If you don't have social work, you're going to be responsible for getting who lives in the house, the ages and names of all the family members, what is their kind of living quarters, where do they live, who do they live with. But they basically just ask you to tell the story. What are your suspicions? What are the injuries? What are you going to do? ACS will either then accept the case or refuse it. You can obviously push back if they make a decision that you don't agree with, but you can't change their mind. But usually, I mean, I don't think I've had ACS refuse a case that I've pushed for strenuously. And then they will either, depending on what it is, they will come to the hospital, they will go visit the kid at home and do a home visit. They will do a home visit before and then call you and say, oh, it's okay to let him be, or they'll just meet the family at home. They're able to look up if there's past cases called against that parent. But yeah, there's a number, 1-800 number in every state. You just call and they'll walk you through the process. In New York City, New York State, there's a form that everyone has to fill out. It's a 2221 form. That's just a standard form for everything that happens. Our social workers do it all the time. You actually never see it, but you just have to know what your hospital or state policies for the workup is, but ACS will help you with that. So just call them and they will kind of help you with any questions you have. But you have to call. If your social worker doesn't want to call and you think it's important, you pick up the phone and call.
Yeah, that's what I was going to say. I've done it a couple of times. The social worker didn't want to call one in particular. And the big logistical thing is have all that information about the loss mention, because I messed that up the first time. Just hold a second. So, like the address of where they live, phone numbers, all the people involved, like have all their names and everything. So, if the social worker did see the patient, a lot of times they might want to know to reference something like that, but that's the logistical thing.
Yeah, I mean, if you've ever seen a social work note on these cases, just read it. And just the information that they have is everything you need to know. And they get a lot of information in there.
Do you have any advice on how to tell parents that you are going to involve ACS? Like, how do you tell a parent, like,
The easiest thing to do is blame the institution. It's easy. And it's it takes the blame off of yourself. They'll still get angry at you, but it is our policy in this hospital that all little children with these type of injuries get a social work consult and an evaluation. Simple as that. You're not saying that they did it, you're not faulting them, but the child has these injuries, he's a young kid. In order to protect children, like we've had bad cases in the past, so now we do this workup and interview with everybody. And the vast majority of parents understand that, especially if they're not the one who beat their child. They will understand that. And then, that's all you have to say.
You had on this slide that parents that don't vaccinate their kids, it's a form of healthcare neglect, right? In my opinion, but
with the cultural understanding, personal beliefs caveat. But that's more refuses to vaccination, refuses to go to the doctor. We had a neglect case, failure to thrive case a couple weeks ago. Mom went to the 2-month visit, didn't go back to the doctor for the rest of the year. So, but where's your Or they can claim that, oh, I've been going to the doctor, where's your yellow card? Yellow card's completely blank. So not the anti-vaccination standpoint itself, but it can just clue you in as to medical follow-up in general.
How do you approach the situation where you want to open an ACS case or you're suspicious for it at least, but the parents want to storm out like right as soon as you kind of talk to them?
They're not allowed to leave. I mean, in extreme cases, you call security and you can take emergency custody of the child. Again, you can fall back on the institution. Like, you cannot sign children out AMA, basically. There's exceptions, but children cannot be signed out AMA. They're minors. You are the healthcare provider looking out for the best interests of the child. So if the parents want to leave, you don't think it's safe for the kid to leave, you explain to them, like, listen, adults can sign out AMA, children are not allowed to. You can blame it on the hospital, you can blame it on the government, but kids can't sign out AMA. In cases, you call security. Usually hospital security is good at kind of talking things down.
One comment, just so right, when you call social work, right in the chart, so, patient cleared by social work. That's just, doesn't go anywhere. It's not going to help you in any way if it's actually the case. In the end, it's your responsibility as a physician. Their job is to help us in the evaluation, okay? But if you have a suspicion and the social worker does it, and it clears the child, you still need to call ACS. You need to work with the ACS worker. There's some of them that may be different, okay? And if they are difficult, then let us know, okay? But in the end, it's our responsibility to make sure that we do the best for the kid. So please avoid writing in the chart. It's like, sort of clear, patient starts home. But they clear the patient form. Be careful how you write that in the chart.
And it's not going to be on the social worker if you send home a kid that gets beaten. You're responsible. You say cleared by social worker and ACS, I agree with this because, you have to, it's your decision, finally, you're the boss.
Two questions. One, in terms of living sort of in a multicultural sort of society, and different cultures have different expectations for discipline of their children. Obviously, you showed egregious cases here, but say for instance, spanking or things of that nature. How do you sort of determine what is abuse versus what's
Your general rule of thumb is that parental discipline should not leave visual injuries or permanent marks. You're allowed to spank your kid, but you can't leave him battered or bruised. And I mean, we've had cases where parents, oh, this is how I was raised, and those cases come with education, and depending on the extent of the injuries, you figure it out on a case-by-case basis. But normal spanking does not leave marks. You're not allowed to beat kids with rods anymore. Your parents were allowed to, but you just can't do that. Emery?
So, in what you're saying, when I was a very engineer, I was a kid and kept screaming, and the dad came across the room and slapped him. And I was like, oh my God. Like, he was keep screaming. I said, so this is helping? He said, you need to step out of the room. So he abused the kid who couldn't even fight back in front of me, who was trying to figure out how to take care of the kid. But I didn't call ACS, right? You have to use your judgment. The dad is stressed, the kid is stressed, I'm stressed. But you shouldn't leave a mark. You shouldn't, you have to educate people. You can hear sometimes even ED parents are belligerent to their kids, cursing them out, telling them to sit down, yanking them. Just go and try to give their attention, because that will help keep attention on them.
And then one last question. What's the sequelae for opening up an ACS case? What happens down the line? Is it just...
So, depending on what is done, but they visit, if an ACS case is open, there will be some sort of follow-up by ACS to the home and visitations, depending on the nature of the injuries. They will involve police, child abuse specialists, but there is follow-up built into the ACS process. Now, it's not always perfect, obviously, but it's not just a one-time thing.
They actually have 90 days to respond to say, they provide notice back to the hospital on the employment provider of what they found. So if they found it or unfounded, or it's continuously on under investigation. So I Kingstown, there's a protocol, Seth Camp with Jeff overseas right now.
I get an Excel spreadsheet every ACS case.
But there is a follow-up system here where it's a check and balance system where all these suspected cases, there's a coordinator who checks up to make sure they do come back. So we build a safety mechanism by saying that all cases of suspected abuse need a referral to the child abuse specialist, which is Dr. Bruce Wallace. Okay, if they at least go there once. So that's what we do to kind of close the loop. You may not, figure out for sure it is or it isn't. So, yeah, maybe one more visit or two more visits. So we like to send all our suspected cases that if you call ACS 2, that would be.
Yeah. Anyone that gets ACS called, whether they take it or not, she needs a follow-up appointment with the child abuse clinic, the CAC. Because even if you make the appointment, they don't even have to show up. Dr. B. Pasquale will call them if they're a no-show and follow up with the family. But you have to make the appointment so he knows the kid exists.
And again, if you suspect, it may not be, you should call. And let the team figure it out. And the other thing that Jeff made a very good comment is this whole about skeletal survey. If you're going to do one, don't do it in the evening. You never get that right. You never get read appropriately. Just do a skeletal survey, make it clear, let somebody do it, you'll get it beneficial. If you lose a few $1,000, you may save from money.
On that part, if you're thinking that they need a head scan, but it's not for clinical reasons, then they're probably better served by MRI, so don't CT scan them. Because MRI is A, not cancerous radiation, B is showing old injuries as well. So, yeah, just don't.
All right, we're gonna move on. If you still have questions, I encourage you to still bring them to Dr. Rallo.